The 2025 Ontario general election is this Thursday, February 27th, and Fort Erie Mayor Wayne Redekop is working hard to meet with candidates to gather support to keep the Fort Erie Urgent Care Center at Douglas Memorial accessible beyond the opening of the new South Niagara Hospital in Niagara Falls, which is set to open in the summer of 2028. Wayne joins me in studio now. Wayne, the current hours of the Urgent Care Center have been cut in half. What is currently happening at Douglas Memorial?
Yeah, so in July of 2023, the 24/7 was reduced to essentially for the public 10 a.m. until 8 p.m. The nurses and doctors obviously are there beforehand and they have to stick around until all of the patients who've shown up are treated. But you can't get urgent care treatment in Fort Erie before 10 o'clock in the morning, after 8 o'clock, if you're not there by 8 o'clock in the evening. So that's a significant reduction in service and one that's had an impact on our community.
Like we said, we're in the middle of a provincial election. I'm assuming, I know that you've met with some candidates. What have the NDP, what have the Liberals, what have the Conservatives, what have the Green Party said to you regarding keeping this site open?
Yeah, so I've reached out to the three main parties, the Liberals, the NDP, and the Conservatives. So far I've had an opportunity to meet with both Wayne Gates and Ruth Ann Newestig, and both of them have been very supportive of continuation of services at Douglas Memorial, even after the new hospital is opened in 2028 or 2029. And that's NDP policy. The leader of the NDP has taken the same position. That's not quite the policy yet of the Conservative Party. The Premier hasn't responded to our resolution that asks for funding to continue the operation at Douglas Memorial, but we're working on that.
You have an official plan, every municipality does, and population growth is definitely something that's in that plan. Tell me about it, because it's a little ahead of expectations, is that right? Yeah,
so we're completing our official plan review and should have that completed by the middle of this year. As you know, the region went through the exercise and in July of 2022 approved their official plan. And the projections for growth in Niagara, both for the regional official plan and now the numbers that we're using, are really outdated. And those same types of figures, I presume, would have been utilized when Niagara Health was planning for its new hospital. So as an example, the 2051 figures project that Fort Erie will have a population of about 48,000 people. For 2031, the projection was 36,000. We're already at 36,200 people, which means we're 6 years ahead of population projections. For the region, it's the same thing, because as you know, some of the communities have really been growing. Places like Thorold, particularly Welland and Port Colborne, Fort Erie and Niagara South are all growing. And those are the communities that will put the greatest pressure on capacity at the new hospital. And those are the communities that need the health care, the hospital care, the urgent care, the emergency care. So the town of Fort Erie supports the construction of the new South Niagara Hospital, and we've made financial commitment to its construction. And that's all well and good for secondary, tertiary, acute care issues, but it doesn't really meet the needs for immediate care that our residents require.
Now, you passed a resolution, is that right? Can you give me a little more information on that?
Certainly we will continue our battles with Niagara Health and take our case, continue to take our case to the Minister of Health and the Premier. Yeah, so in October 21st, 2024, the Town Council passed a resolution requesting that the province continue to allocate funding for the operation of services at Douglas Memorial without taking any money away from Niagara South for the operation of the new hospital or for the construction of that new hospital. And we did that simply because we're concerned that the new hospital will not have the capacity to meet the needs of the residents of not only South Niagara, but all of Niagara, because it's one large picture. That resolution was supported by the City of Niagara Falls, interestingly enough, because this is where the new hospital will be located. I believe that they recognize the problems in terms of emergency care and the need for continuation of urgent care. And on Thursday last week, I asked the Regional Council to support that resolution, and they did unanimously, because it's not just a Fort Erie issue, it's a Niagara issue.
About a year ago, maybe a year and a half ago, the Leisureplex hosted Niagara Health with one of their seminars about what's going to happen in the next 5 years or so. Not an empty seat to be had, is that right?
It was packed, and it typically is packed whenever there's something that relates to the community and access to health care. We have no problem filling facilities. In 1997, 5,000 people at the Leisureplex. In 2008, 5,200 people at the Leisureplex. And so these opportunities are very well attended by people. It gave Niagara Health an opportunity to explain to the public why it was necessary for Niagara Health to close Douglas when the new hospital is opened. I can tell you that that's not a very popular position in Fort Erie. And I don't believe that Niagara Health fully appreciates how visceral an issue this is for the people of Fort Erie. I mean, it cuts really to the heart of an institution that's been in our community since 1931, built through the legacy left by William Douglas when he died in 1929. And so I had an opportunity to speak at that meeting, and my advice to the Niagara Health representatives was that they have their plan. It's a 3-site plan. Our plan is to derail their plan so that they continue to operate Douglas Memorial.
There was a Healthcare Services Advisory Committee, but now there's some departures from that committee. Can you give me a little information on that?
Yeah, there was a meeting last fall, I guess it would be, where a representative from Niagara Health attended a meeting that was set up by Ontario Health Team Niagara, that was attended by some doctors and some representatives from the town. Apparently there were some things that were said that left the representative from Niagara Health feeling uncomfortable, and so that may have been the culmination of a number of issues. They were represented at this committee, and the committee, of course, would say things that representatives from Niagara Health really didn't want to hear. But they're the things that they may not want to hear them, but they need to hear them because they're reflective of what's happening in the community and what the people in the community are seeing. So anyways, they decided to withdraw from that committee. But we've had some good meetings recently. I met with the Board of Trustees about 3 weeks ago. I met with the leadership of Niagara Health a couple of weeks ago, and they've indicated that they're prepared to participate again in the advisory committee meetings.
About 90 seconds left, Wayne. Where do you go from here?
Well, we're going to continue on making sure that Niagara Health hears our message, that the Minister of Health hears our message, that the Premier hears our message, that Douglas Memorial is a fundamental aspect in the health care, not only of Fort Erie, but of all residents in Niagara. And so we're coming up with a model that we believe will attract attention of the Minister of Health and the Premier, that will allow Douglas Memorial not only to be the primary care safety net for Fort Erie, but the safety valve for Niagara Health as they go forward, because we're pretty confident that the new hospital will not meet the capacity needs of the residents of Niagara.
Wayne, thanks, and all the best with your fight.
Thanks very much.